Okay, so welcome back to this next video in which we are discussing diabetes mellitus and anti-diabetic drugs. Okay, so the final three classes of anti-diabetic drugs that we are going to discuss are all going to help with the postprandial glucose spikes. They're all going to help control the postprandial glucose spikes, but they're not really going to help control the fasting state hyperglycemia. Okay, so these drugs are often going to be given in combination with other drugs which will help to control the fasting state hyperglycemia. Okay, so the first drug class that I then want to talk about are alpha-glucosidase inhibitors. Okay, so before we can discuss what an alpha-glucosidase inhibitor is going to do, we firstly need to discuss what alpha-glucosidase actually is. So this is an enzyme which is involved in breaking down oligosaccharides within the intestine to monosaccharides. Okay, so it's an enzyme that is going to be an integral membrane protein and which is going to be implanted into the membrane of the cells which line the intestine. So this is the lumen of the intestine. Okay, this is the cytoplasm of a cell which lines the lumen of the intestine. Okay, and this here, drawn in the classic way that an enzyme is usually represented, is the alpha-glucosidase enzyme here in orange. Okay, right, now what then is the alpha-glucosidase enzyme going to do? Well, it's going to break down oligosaccharides into monosaccharides. So an oligosaccharide is a short polymer, a very short polymer, okay, of monosaccharides. So for instance, it could be a little polymer of glucose molecules like so. So I'll draw 3 maybe like so. Okay, so it's a little polysaccharide basically. So an oligosaccharide implies that it's a very short polysaccharide. And I'm not going to fit that in, well, I'll have a go. Okay, so an oligosaccharide, here we are. Okay, so what the alpha-glucosidase enzyme is going to do is it's going to break the bonds between these glucose monomers in the oligosaccharide. So it's going to cut here and here basically. And it's then going to release the monomeric glucose molecules which can then be absorbed into the blood. Okay, so we can give drugs which will inhibit alpha-glucosidase. Okay, and those are known as alpha-glucosidase inhibitors. And an example of an alpha-glucosidase inhibitor is acarbose. Okay, so what is the effect of this? Well, you're not going to completely inhibit the enzyme. All you're going to do is reduce the activity of the alpha-glucosidase enzymes as a whole when you view them in the whole intestine. Okay, so you're not going to inhibit absolutely every single alpha-glucosidase at every single second using this drug, but at any second you're going to have a good fraction of them not functioning. Now what does that mean? That means that when you eat a carbohydrate-rich meal, the rise in glucose that you get due to eating that meal is going to be slower. Okay, so the rate at which glucose is going to be entering the bloodstream is going to be slowed down, basically. Now that is a great advantage if you have diabetes, because remember, if you've got diabetes, you've probably got some sort of problem with insulin signaling. Okay, so for instance, if we consider type 2 diabetes, you've got insulin resistance. So even though the beta cells release insulin in response to the postprandial glucose rise, the liver skeletal muscle and adipocytes are not going to respond to it correctly. Okay, so you're not going to be getting glucose taken out of the blood in the way it needs to be. Okay, so if you're getting less rapid intake of glucose into the blood, okay, that's going to mean that it's more manageable, even with the insulin resistance. So this is going to help reduce the size of those postprandial glucose spikes, because even though you still will absorb all the carbohydrate, because eventually, you know, the carbohydrate will get digested even in the presence of the alpha-glucosidase inhibitor, it will be absorbed more slowly if you've got an alpha-glucosidase inhibitor. Okay, so the glucose will be absorbed more slowly, and that means that the postprandial glucose spike will not be as high, basically. Okay, and remember, it's the postprandial glucose spikes becoming extremely high that does the damage to the blood vessels, the microvascular and the macrovascular disease that are the chronic complications of hyperglycaemia. Okay, so alpha-glucosidase inhibitors are going to help control postprandial glucose spikes. Okay, the next class of drugs that I'd like to talk about is incretin mimetics. Okay, now again, I've only got one example of an incretin mimetic, and that is exenatide, okay, which is a mimetic for glucagon-like peptide 1. So exenatide, which mimics glucagon-like peptide 1. Whoops, what have I done there? Mimetics, mimics, okay, glucagon-like peptide 1, GLP-1. Okay, so it does a similar thing to GLP-1. It will activate the same receptors as GLP-1. Now remember, what did GLP-1 and GIP, glucose-dependent insulinotropic polypeptide, do? They potentiated the rise in insulin that is caused by beta cells releasing insulin in response to glucose going up. So remember, if glucose just goes up without the rise in GIP and GLP-1, then what happens is the beta cells will release insulin, but the amount of insulin they release will be hugely potentiated if you add in GIP and GLP-1. Okay, so GIP and GLP-1 do not cause insulin release on their own. If you just put these without the glucose, that will not cause insulin release, but they can potentiate the amount of insulin that is released in response to glucose, so that you will release more insulin in response to the same rise in glucose. Okay, and that's exactly what you need if you're suffering from insulin resistance. You need more insulin to be released in response to a certain rise in blood glucose, because your liver, your skeletal muscle, and your adipocytes are resistant to the insulin. Okay, so by giving the GLP-1 mimetic, such as exenatide, we can increase the amount of insulin that the beta cells release in response to this postprandial glucose rise, and therefore, despite the resistance of the liver, skeletal muscle, and the adipocytes, it may well now be that we've released enough insulin to have a normal effect on blood glucose and bring it back under control and keep that postprandial glucose spike as low as possible and as unbroad as possible. Okay, so again, this helps you to control postprandial glucose rise. Okay, and then finally, the final class of anti-diabetic drugs that I want to talk about is DPP-4 inhibitors, okay, which inhibit the enzyme dipeptidyl peptidase 4. Now, these drugs are also known as the gliptins, again for the same reason as the thiazolidinediones are known as the glitazones. Okay, they all end in the suffix gliptin. Okay, so let me give you some examples. Two examples are sitagliptin, okay, and also vildagliptin. Okay, so vildagliptin. Okay, so these two drugs, what they do is they inhibit this enzyme that is found in the plasma, okay, which is dipeptidyl peptidase 4. Okay, now this enzyme is responsible for breaking down the endogenous incretins, okay, GLP-1, glucagon-like peptide 1, and GIP, okay, which is glucose-dependent insulinotropic polypeptide. Okay, so this breaks down GLP-1 and GIP. Okay, so if you inhibit this enzyme, that means that GLP-1 and GIP are going to remain in the blood for longer, and they're going to reach higher levels. Okay, so effectively what you are doing is increasing the body's own incretin effect. Okay, so let's say you have type 2 diabetes and you eat a carbohydrate-rich meal. You're going to be releasing the incretins, GIP and GLP-1. Okay, now, if we've inhibited DPP-4, these are going to go up to much higher levels and they're going to remain high for longer. Okay, that means that how much they're going to potentiate the beta cell release of insulin is going to be greater. So when the glucose rises because of the carbohydrate-rich meal, the amount of insulin the beta cells are now going to release is going to be bigger than before you took the drug. Okay, so that's going to help to deal with the insulin resistance. So it's another way to increase the incretin effect. We've just seen the incretin mimetics, which is the way by which we can just add in exogenous incretins, okay, but now we've seen another way of doing it, which is just let's increase the endogenous incretin effect by reducing the breakdown of the endogenous incretins by blocking the enzyme dipeptidyl peptidase 4, okay. So that's the final type of anti-diabetic drug that I wish to discuss. Okay, so that now concludes our discussion of diabetes mellitus and the anti-diabetic drugs.